Okay, we're live.
Hi everyone, good afternoon. Welcome to Alvernia Live Chat. We are now live across Instagram, Facebook and TikTok. My name is Dr. Tricia Kuo.
I'm Dr. Jolie.
And we're both urologists practicing at Mount Alvernia Hospital. And we're really glad you have taken the time out during lunch to join this conversation with us. Today the topic is on common urinary concerns from mild symptoms to warning signs, and we'll be sharing and answering your questions on exactly that. Do leave your questions you have in the chat function and we'll do our best to get to it today. So Joe, the first question for you really.
Okay,
We've already got people posting questions. I heard that drinking cranberry juice or taking cranberry supplement is good for urinary health. How does that work?
Well, I think cranberry juice, right, has been shown to actually reduce the risk of urinary tract infection. A lot of us wonder why, right? Why it's so special about cranberry juice, right? So the fact is for urinary tract infection to happen, bacteria in the urine needs to stick onto the wall of the bladder, and that's when it starts to cause an infection. So what happens is that in the cranberry juice, there are actually naturally occurring substances that blocks off the receptors on the bacteria. So it makes it harder for the bacteria to stick onto the wall and hence reduce the risk of infection. Am I right, Dr. Tricia?
Yes, absolutely. Yeah. Yes, so I think we also in our practice quite commonly give our patients supplements such as cranberry supplements for prevention of UTIs.
Yes.
Yeah.
So the next question is, do we have to take this like does a normal person have to take this regularly, to prevent that? I would say it's quite specific, right? Those who have a need for it, you can take a cranberry juice or cranberry extract. If let's say you're prone to getting urinary tract infection.
Yeah.
Otherwise, healthy individual, I think it's probably not
not absolutely necessary. Yeah. The other thing I wanted to stress to the patients is a commonly asked question that I always get in my practice is, can I take cranberry supplements or juice to treat the active UTI?
So how do you advise your patients?
Yeah, so I always tell them that if you have an active UTI or a urinary tract infection, you need to have a full course of antibiotics first.
Yes, that's
because
right.
the cranberry juice and supplements are mainly for prevention of the next infection and not the active treatment of the current one.
Correct. In fact, you just brought up a very good point, Tricia. Meaning to say that if a person is having a urinary tract infection, maybe at a milder stage, if they just take the cranberry juice or extract, it may not really help them get rid of the disease. In fact, it may drag on the process and cause their condition to worsen. That's a very important point to note.
Yeah. Okay, so I think we really just dive right in. I think before we take the next question, maybe we'll just introduce ourselves a little bit better.
Please, ladies first.
So actually what most people don't realize is that we urologists do see both male and female patients. We are really both a surgical and a medical specialty where we do treat diseases surgically as well, such as kidney stones, tumors, as well as unfortunately some people do have cancer. So we do treat our patients with those conditions as well. We all have our subspecialization. So my subspecialization is functional and reconstructive urology, and by the fact that I'm a female, I do tend to see a bit more female patients, but I do see male patients in my practice as well.
Yeah, so you're right. So what Dr. Tricia shared is exactly what the urologists do, right? Urologists basically we deal with anything that's in the urinary tract, right? So besides the key organs that I mentioned, there are also a lot of men with problems with the male genital. Could be sexual dysfunction, could be fertility problems, could be problems in the testes, and these are also conditions that the urologists will see.
Yes.
So in my practice, I tend to see a lot of men with men's problems. All right, and these can include things like the prostate problems, maybe a penis that's not functioning the way that it should be, or men with facing fertility challenges. Right? So I think it's very important for our audience here to understand the scope of the urologist, so that when you do face any problems or know of somebody who faced certain issues, you can at least they know where is the channel to look for further help.
Yeah, so actually a urologist does cover a broad range of medical and surgical issues.
Yes, that's true.
So for the audience, can please go ahead and leave your questions in the comments and we'll get to it during the session itself.
Okay, so all right. I think I see another question popping up here, right? So it says here, I tend to hold it in when I am busy. I guess that means holding the bladder and not going to the toilet to pass urine, right? Of course, holding it can be holding in the feces, but you don't have to go to the toilet in mass motion. But this is urologist talk, so I think it's probably urine, right? So then, can that cause long-term bladder issues, right? Just now I answered the question. Maybe Dr. Tricia, you want to share with us how would you advise the person who asked this question?
Yeah. So I always tell my patients, sometimes that is a tricky question to give a blanket answer to, because it depends on someone's fluid intake and water intake throughout the day. Okay, but of course we have to presume that everybody by right has a normal fluid intake throughout the day, which should ideally be between 1.5 to at least 2 liters a day, because we are living in Singapore as a hot, humid country, and we tend to lose water through perspiration and when we talk as well. So if we're drinking a normal volume, ideally we can hold the urine for at least 2 to 3 hours, and ideally not to exceed 3 to 4 hours. And pee regularly. So if you're holding it in, try not to exceed that recommended time period. The only exception, of course, is when we're sleeping at night. We'll be sleeping for hopefully at least 6 to 7 hours, having a good night's sleep. Now, however, this is always a tricky question. So sometimes when we have people with certain bladder conditions like overactive bladder, after we've gotten them to complete something called a frequency volume chart or a bladder diary, we can tell them to hold it in on purpose, because these people tend to pee more often than is what is normal. For example, they can pee every 15 minutes, every half an hour. And if we see that in the bladder diary, their bladder volume is very low, like only 50 mils, we do tell them to hold it in on purpose for extra 15 minutes or half an hour, and that's called bladder retraining. So that's usually only safer to do once you've done the bladder diary, of course.
Yeah. So this issue of holding the bladder excessively is really, I would say, not a good idea. Right. So over the years, I've noticed, I've seen patients, I've seen children, right, in school. They just don't want to go to the toilet. They have this habit of holding their bladder because maybe the school toilet is not clean or for various reasons. And I'll say that for a child who's growing up, getting them to have a good habits, if they have the urge to pass urine, your body needs to pass urine, just go ahead. Because holding on excessively will overstretch the bladder. It's not good for the muscles. And over the years, I think I've come across a certain group. I don't know whether you have a personnel who work on the airlines.
Yes.
I've seen a couple of these stewardess who they just hold their bladder during work because they're very responsible. They're working. They find it hard to go to the toilet on the plane. So over time, you should realize that when they empty their bladder, they cannot empty it fully as what they should.
Yes.
And that can make it prone for them to develop other kinds of problems.
Yeah, I think that's a great point. I've seen a few other occupations that what we call occupational hazard. So it's like the air stewardesses, nurses,
correct.
shift workers, taxi drivers. Yeah.
So for various reasons, some find the toilet too far away. I don't go there; it's too troublesome. Right. So our advice here, and I think Dr. Tricia will agree, is that listen to your body. If you feel the urge, your body says your bladder is full, you need to go to the toilet. Just oblige, all right, because you are doing a great service to your organs by making them healthy.
So actually a good guide maybe is we can tell if you're drinking a normal volume of water every day, spread equally throughout the day, your maximum bladder volume may be about 300-400 mils, and try not to exceed that. Okay. We've got a fun question from IG. Is it more male uro than female uro?
Okay, so is this about the male uro patients or male urologists? Right, but anyway, we can answer both, right?
We can answer both.
So I will say that I'll answer the first part. Is that more male urologists than a female urologist? Right. So based on numbers, there tend to be more male urologists, but things can change. Increasingly, we are seeing a lot of also female urologists. Somebody excellent like Dr. Tricia, right, who has come in to take on the role of taking care of not just general urology, also the very specific conditions that affect the female. Now, with regards to whether there's more male patients or female, I don't know. Tricia, what do you think?
I think that really depends on someone's practice. Because as I said in our introduction,
Yes.
because I'm female, I tend to have more female patients, and that's very understandable. And I'm sure as a male urologist, you tend to have more male patients.
Correct. I would say that because my practice is a lot in urology, I subspecialize in andrology, which is looking after the male part of the urological problems. So I would say that the majority of my patients actually tend to be male.
Okay.
All right.
We've got a few more questions. I think this one came up first.
Yeah, maybe I should, let me see. Okay, let me just raise this question. Right? Hi doctors, if I get UTI 3 times a year, is it normal? Should I get further checks done? Well, I would think that getting urinary tract infection, if this question comes from a woman, right? Women do tend to get a urinary tract infection much more easily or more commonly, right? And of course, the reason is because the female urinary tract tends to be shorter than the male urinary tract, so probably easier for bacteria or organisms to reach the urinary tract and cause an infection. But 3 times a year, some will say that for a woman, maybe up to 3 times a year is not too bad a thing, all right? Because it's quite common. But if it's quite mild, it's not really complicated, they get well quite fast with treatment, it's fine. But I would say that having urinary tract infection often it's important to ensure that there's no underlying problems, right? Because there can be structural problems within the urinary tract that can be leading to this. It's not just a female having a shorter tract, there can be other problems. There could be things like strictures, which is basically narrowing of the urinary tract. There can be things like a stone that can also increase the risk of urinary tract infection. So if a person facing this problem has never been checked or seen a doctor, maybe a good idea to get a check, so that if there's something that's correctable, right, it should be corrected.
What would you say are the red flags that the patients can look out for if they have like maybe 2 to 3 infections a year? And are there like certain red flags that that they might look out for that prompt them to see the doctor earlier rather than later?
Yeah, so of course one of the things is urinary tract infection. When we talk about it, a lot of times the patient experiences maybe a burning feeling when they're trying to pass urine. Some may have they may see a bit of blood, they may have fever, right? However, if the infection that starts in the lower urinary tract, right, moves up to the upper urinary tract, which is the kidneys and all that, it tells us that this is not just a straightforward infection, right? When the upper urinary tract is involved, it may have pain, it can cause, I think can do bad things to the kidneys. Which is why if such things are happening, it's complicated, right? So it shouldn't be just treated as something that can be acceptable as a part of the norm. Would you like to add to that, Dr. Tricia?
Yeah, I think we do on occasion see patients that come in after waiting a few days after urinary tract infection. They didn't get antibiotics early, and then they come in with high fever where they're really sick, and then blood tests are showing that they have very bad infections. So I think those are, to me, are the red flags, because I think it could have been prevented, as in the visit to A&E could have been prevented if they had started antibiotics earlier.
Definitely.
Yeah. Okay, our next question is, hello Dr. Lee and Dr. Kuo, is drinking lots of water beneficial or harmful to our urinal system? Yeah, so it's always I would say life is a bell-shaped curve. So life is not, it's also a box of chocolates, because Dr. Jolie is an expert in chocolates as well. But life, I always tell my patients, is a bell-shaped curve, where if you're drinking too little, it's not good. If you're drinking too much, it's not good. There's always a nice sweet spot in the middle, where ideally you should be, as I mentioned earlier, drinking about 1.5 to 2 liters a day. If you're exercising outdoors a lot, or that particular day running a marathon, you may even need up to 2.5 or 3 liters. So it really depends on your day-to-day activities.
So everything in moderation, right? Moderation is always better than going to the extremes of too much or too little.
Yeah, that's right. Exactly. Yeah. So do send your questions through. We just waiting for the
I see another question coming up, right? Is it normal to pee at about 12 a.m., 2:30 a.m. and 6:30 a.m.? Okay, All right. I presume this person is who asked this question, right, is waking up 3 times a night to pass urine. So we call this situation, we call it a nocturia. Means you have to wake up at night a few times to pass urine. Now, is it normal to do that? The answer to that is actually it is well, if a person drinks excessive water before sleep, right, he may wake up one time, right? But to wake up more than that sometimes is not, could point to some issues in the urinary tract. If it's in a male, an older male, sometimes it will be because of prostate problems, which is actually quite common in the group of patients that I see, right? Men, maybe 50s and above, find that they have problems passing urine. Either the urination is a bit slower, right? Need to wait a bit longer. It's not as strong as before, means the stream is not strong as before. Or they realize they have to wake up a few times at night to pass urine. Whereas in their younger days, they can probably sleep through the night without having to wake up at all. Yeah, correct. Yeah. So if faced with this kind of situation of a nocturia, the best thing to do is, of course, you can see your doctor and maybe a urologist as well to get the evaluation. If it's really a prostate problem or other causes is identified, there will be a treatment to alleviate that. Because waking up many times at night actually does disturb a person's sleep. The next morning he wakes up, he may feel like tired, he didn't get well rested, can even affect a person's work performance. Right?
Yeah.
Yes.
Okay. Yeah. So we've answered that question. We'll move on to the next one. Is it okay to start Ural QDS on my own if I suspect a UTI is going to start? Now, when they say QDS, I think they mean up to 4 times a day, which is okay. That's the higher limit for Ural. So Ural, just to clarify, URAL is a urinary alkalizer, and we quite commonly give it to our patients when they have a burning sensation or what we call dysuria when they have a urinary tract infection. So it's perfectly okay to take Ural for the first 24 hours. Some people have very good immune system, and if it's a very mild UTI, they are able to fight off the infection and it goes away. But however, if you have a persistent UTI symptoms even after 24 hours of taking Ural, my advice is to go and see the GP or a doctor who is able to treat the infection and start antibiotics if those symptoms are persistent.
That's a very good answer. So, okay, for those who just joined us, welcome to Alvernia Live Chat. All right, and well, this is Dr. Tricia. All right, I'm Dr. Jolie. Both of us, we are urologists who practice in the Mount Alvernia Hospital. So we are really glad that you've taken time, right, during lunch to join us in this conversation. Okay, so let me see. The questions are slowly coming in. Yep. Okay, so I would say that as a urologist, all right, one of the things that I see is that the patients sometimes they are not fully aware, or they're not sure of their conditions, and sometimes that may delay the time when they first notice something was wrong and then seeking help. Right? Yeah. So one of the common symptoms that the patient sometimes may ignore, which are actually sinister, is having blood in the urine. Yes. Also having blood in the urine, it can either be blood that they can see, right, what we call gross material. So that usually means that when they pass urine, they say that how come my urine looks like this blood stain? It's either pinkish or it's reddish, right? So these are some of the more sinister symptoms that may be associated with more sinister conditions. And sinister conditions can range from things like cancer in the urinary tract, all right, and or even or stones or other conditions. So I would say that what I realized is that when there's blood is seen in the urine, to really take that seriously.
Yeah, I think it's a very good point. Yeah. Okay, I think we have a next question.
Yes. So maybe Tricia, maybe I can ask you this question, right?
Sure.
So this person realized that after a night of drinking, all right, I don't pee no matter how much water I drink. Am I damaging my kidneys? Means to say that after a night of, I think, very heavy drinking, a lot of alcohol, right? You find it's hard to pee no matter how much he drinks.
Oh, okay, that's a very interesting question. Yeah. Now, alcohol, unfortunately, is one of the things that can aggravate urinary symptoms.
Yes.
And along with excessive amount of caffeine. So we tend to tell our patients, particularly if they have underlying bladder problems, to limit the amount of coffee, tea, and caffeine, as well as alcohol intake. So the commonest example we usually give our patients is try not to exceed more than 2 to 3 cups of coffee and tea a day. But with regards to this alcohol intake, I think sometimes the excessive alcohol intake can be related to producing a lot of urine, because it's a diuretic. And when someone's bladder is overstretched or overfilled, sometimes even up to 1 liter of urine can be retained in the bladder. It's very hard to empty out that very high volume of urine all at one go.
Correct.
And someone's sensation can be affected if this happens very regularly and the bladder is overstretched. So maybe they have a lot of water or urine in the bladder, but they are not able to sense that they have a full bladder. Potentially that's a dangerous situation, and yes, if that happens every day, they can potentially damage their kidneys, unfortunately.
Yes, so to the person who asked this question, right, one thing we would like to ask you as well, if you are still there, is that number one, when you say that you have you don't pee no matter how much water you drink, right? Is it that you feel like you have a full bladder, you really need to go, but you simply find it difficult to pass urine, or you're not making much urine, means you don't really have the urge at all? So
yes.
Either way, it may present an issue, but different issues. If you find that you want to pee but you can't pee, then what Dr. Tricia mentioned is exactly something you should be concerned about. Whether your bladder is still working well. Then of course, if you are not making much urine, well, the normal kidney should be making urine 24 hours, so there will always be urine. So if you reach a stage where somehow you are not able to produce urine, it could mean a state of very bad dehydration, or sometimes it point to having underlying kidney diseases.
Yeah. Okay, next question is for me, I guess. Can period-related changes affect how often I pee? Okay, so if someone has a normal menstrual cycle, usually period-related changes doesn't really affect how often they're passing. However, there are very rare instances where ladies have things like endometriosis, and that's a condition where they can have pelvic pain because there's blood deposits in other parts of the pelvis besides being only in their uterus. These ladies potentially can get bladder conditions as well that affects how they pee. They can have voiding problems as well, but these conditions thankfully are quite rare. So for a normal person, period-related changes don't affect how often they pee.
Yes. So I think that's a very good answer that Dr. Tricia has shared. I see another question here. Okay, I'm just going to read it out, right? How can I tell the difference between UTI, which is urinary tract infection, and something more serious, bracket female? Okay, so it's you ask me this question. Okay, I think it really depends on how the UTI presents itself. UTI can present in different ways, right? So, and UTI can be caused by other underlying problems. So a UTI may not be just a simple and straightforward UTI, maybe what you call a complicated UTI brought on by other conditions, right? Now, so what do we think is serious, right? So if let's say the person has a urinary tract infection that's happening quite frequently, or is taking a long time to resolve each time it happens, or it affects other parts of his organ, maybe the kidney, right?
Yeah.
Then this is definitely something that's not so straightforward. That has to be it's best to see a doctor and then get investigated, evaluated, and then treated for that condition.
Yeah.
And something more serious. So in a urinary tract infection, right, the typical symptoms one may have could be I have pain or burning sensation when I pass urine. I go to the toilet more often. I need to go more often, right? Or I can see blood in my urine. My urine just looks bloody. So I would say that when you talk about something that's more serious, some of these symptoms, like seeing more blood in the urine, is definitely something of a concern. All right. And when we see blood in the urine, if it comes with pain, it may be UTI. If it comes with no pain, then in fact one would think that no pain may be better, but no. Having no pain when there's blood in the urine is actually worse because that's more sinister. It may point to some other conditions, dangerous conditions, right?
Yeah.
Like urinary tract cancers.
Yeah, yeah. So I think to summarize, we would say that the red flags are blood in the urine and high fever.
Yes.
Yeah,
Right.
yes, agreed, yes. Okay, so actually we have another question. What do you guys specialize in? Yeah, so I think we gave a bit of an introduction earlier on.
Let's do it again for those who just...
yeah,
just
that's right. So we're both urologists and we both see both male and female patients. And urologists are people who specialize in looking after the urinary tract.
Yes.
And we do treat conditions both surgically and medically as well. So within the subspecialization, within the specialty of urology, we do subspecialize in certain conditions. So mine is functional and reconstructive urology. So functional problems, whenever I say this, people always get a little bit confused. Yeah, it's to do with issues with the bladder and the lower urinary tract. So if someone is having any leakage of urine or the opposite problem of having retention of urine, be it male or female, that's functional urology.
Yes.
Yeah.
So always remember, for the urologists, we look after wherever the urine passes through. Right, urine is made in the kidneys, it goes down the ureters, it goes to the bladder. In the male, it passes by the prostate, right?
Yes.
Then it goes to the urinary tract, and most of the time, the urine, the opening is at the genitals, right? So anything along this tract will be the situations that the urologist will take care of.
Yeah. So we have a next question. Oh, how about UTI in children? If there's no fever, just pain when peeing, should we just monitor or bring to see a doctor immediately? Okay. So whenever it comes to the differences between children and adults having urinary tract infection, it's always a little bit different on how we approach, how we treat, and how we do investigations or tests. We do see people who are aged 13 and 14 and above, but generally below 13 and 14, we would recommend seeing a pediatrician actually, or someone who specializes in ped surgery is also a good idea.
Yes.
Yeah.
So this question probably comes from a very concerned parent.
Yeah.
A kid is having pain when it's peeing. What should we do? Should we wait or should we bring her to see a doctor? I would think that if coming from I'm also a parent, so I would think that most of the time most parents will watch, right, and see whether the child gets better. But my suggestion is don't wait too long. Why? Because if the child is really having because number one, for a kid to have pain when passing urine, is that normal? That's not really normal, right? Why should a kid out of the blue have pain when he's passing urine? Right? So if it's really the most common thing for children who has been well all this time could be that they may have got some bacteria enter the urinary tract and now it's getting inflammation and pain or discomfort, and by itself is it likely to go away, or is there a chance that it may get worse now? So I would say that it's always best to get professional advice. You can see a doctor, you can see a family doctor, pediatrician, urologist. Just see somebody and get the child examined, tested, and then institute treatment when it's necessary.
Yeah, agreed. Yeah. Okay. Next question. Is it true taking daily cranberry supplements can prevent UTI? Yeah. Actually, I think we briefly answered this question right at the beginning.
Yes.
Yeah.
So for those who just joined, I think Dr. Tricia, I think just now you agreed that it's good for prevention.
Yes.
But it's not really a treatment for UTI.
Agreed,
right? If there's an active urinary tract infection, cranberry juice may not be the way to manage it.
Yep.
Yeah, but for somebody who has it very often, I think prevention, it does help because of the substances in the cranberry.
Yes. Okay, we just have about 5 minutes left in our time today. So thanks for being so forthcoming with your questions. Maybe we can take 1 to 2 more questions, and then feel free to leave any comments. And thank you for attending the session today and joining us during your lunch hour.
They're probably having lunch while they're
Yeah,
listening
that's
to
right.
this.
Yeah.
So, all right. So if you have any other questions, we'll be happy to take it and answer together with Dr. Tricia here. So for men who have one of the common things that men face in terms of urological problem will be related to the prostate. Right? With Singapore's aging population, actually, prostate cancer seems to be one of the common conditions that they may face in terms of male cancer. And how prostate cancer is diagnosed a lot of times is that during health screening, people will do some blood tests, and then they realize that this thing called the PSA, which is the cancer marker for prostate cancer, is raised. And that will then trigger the need to see a urologist, get the necessary scans, even biopsies to evaluate, see whether there really is such a cancer underlying.
Yeah, that's one of the common questions we get when we do public talks as well.
The models. Somebody's asking about the
so
models.
that's thanks for asking that. Actually, I brought the models from clinic. Yeah, no problem. Very happy to go through the models. So as you can see, we purposely put the female model on my side and the male model on Joe's side. So I will explain the female one and he'll explain the male one.
No problem.
So this is the front and that's the back. So that's the front of your tummy and this is the bum, oval on this side. So for us ladies, actually this is quite a lot of organs that's squeezed into a small little tight space. So this is the urine system here at the bottom. That's the urethra, or what I call the lower passageway or the pee pipe. That's the bladder in front. And then right in between is the vagina, and then here is the uterus or the womb. And then right at the back for us ladies is the back passage where we pass or poop from. Okay. So that's why from front to back, that's once again the bladder, vagina, the womb, as well as the rectum or the part, which is the lower part of the intestine. So for us ladies, really the reason why we're getting such frequent UTIs sometimes is unfortunately we're not very careful when we wipe. If we accidentally wipe the poop from the back to the front, that's where the bacteria gets transmitted. And unfortunately it can go upwards and cause a urinary tract infection. So for ladies, it's always very important to remember when you're cleaning and when you're spraying water, always spray and wipe from the front to the back. That's the correct direction. Okay.
Okay, we are low on time, but just to be fair to the men, right, let's just finish this part. Otherwise the men, they feel like they're not taken care of, right? So anyway, for the male, it's pretty straightforward. You have the bladder, right, and it goes down this part. So this organ here is called the prostate, which is why when the prostate is big, it squeezes in on urinary tract, you'll find that the urination may be slower or more difficult. Urine then goes down the urethra along the penis, right? So the penis is not just a sexual organ, it's for urination. And at the back here, this is the anus over here. So when sometimes people, when at a clinic, a doctor will put a finger up through the anus to feel for the prostate, right? So when you put the finger in, you can feel some parts of prostate to tell whether it's enlarged or whether there are underlying conditions. Okay, all right. So we have completed the sharing of and answering the questions. What is this last question?
Actually, we have one last question each.
Okay.
Do you want to go first? I think yours.
Okay. Why don't I answer this one first? Is it normal to feel that peeing is not finished? Is that any indication? Right. So definitely, if a person is emptying his bladder quite well and is the urinary health is in a good state, right? After they pass urine, they should not feel the urge of having something left behind or need to go again at all. Right? So if a person is having a feeling that something is incomplete, it either A means that there's a retention, means is not able to empty the bladder like they should, which then may point to underlying obstruction. Something is blocking the urine cannot drain properly because something is blocking it. In the male, it may be a prostate. Of course, other conditions can also cause that, right? So the straightforward answer to that is if after passing urine you feel that there's still urine left behind, it's not okay. See a doctor and then get evaluated.
Okay, and then the last question for myself: what are the possible treatments for incontinence, particularly in female patients or ladies? So it's very hard to go into the details because this is a question that has multiple possible avenues of answer depending on what the subtype of incontinence is. So incontinence really means that it's involuntary loss of urine or leakage of urine, of which the two broad categories are stress incontinence and urgency or overactive bladder incontinence. Generally, what we would tell our patients first is whether or not we can try some lifestyle changes. We always start with that first when it comes to treating incontinence. So it may be looking at the water intake, type of fluid, as you mentioned earlier, caffeine and alcohol. And we generally start both categories of patients on pelvic floor exercises or Kegel exercises as well. Now the specific surgical treatments thereafter or the medical treatments depends on what the subtype of the incontinence is. Yeah.
So I think to put it simply, if let's say you find that you're wetting yourself and you don't really want to wet yourself, sometimes it's embarrassing, right? Sometimes you feel like you smell of urine, all right? Dr. Tricia Kuo, Mount Alvernia Hospital, right? She's here to help.
Right. And men's health expert, Jolie.
Okay, all right. So I think we have to thank everybody for being so forthcoming with your questions, and thank you very much for joining me, Dr. Jolie and Dr. Tricia, all right, for this live chat. So it's very fun answering all these questions. In case you missed out on any of this segment, right, where can you view this again, all right? I think the Mount Alvernia is going to share some of these cut downs on their social media, Mount Alvernia Hospital social media site. If any specific questions or advice you require, yes, please reach out to Mount Alvernia Hospital, right? I'm Dr. Jolie and this is
Dr. Tricia.
Yes, all right. We are both in the Mount Alvernia Hospital. All right. Thank you.
Thank you, everyone.
Bye-bye.
Bye.
Bye-bye.